we are going to discuss about some question and answer for NCLEX board. The first question, which intervention should the nurse include when caring for a client who has had the endovascular repair of an abdominal aortic aneurysm? The keyword is here, abdominal aortic aneurysm. The word aneurysm means the abnormal or weakness of the aorta wall. So when any particular area inside the wall of the aorta is weaker, the chance of blood go into the weak point and make a bulging, or this bulging area sometimes tear up like this picture. This is the abdominal aorta. Because of some structural defect, this area were weak, and when blood or liquid is go through, they put a pressure and bulging. The danger is here, this aorta sometimes rupture and causes life-threatening condition. As a RN or LPN, when we examine the patient, we never ever palpate it. Let me go back in the question first. So, what nursing interaction should include when you take care of a patient who is diagnosed the abdominal aortic aneurysm? Select all. Assess the abdominal incision for every 4 hours. So examiner always want make you confusion. In the modern surgical procedure, we do not need any kind of incision to correct the abdominal aortic aneurysm. We approach in the femoral area and then by do the passing the catheter and we can correct it. Check the bleeding in the growing puncture site. Yes, it is the answer. One of the best option. So I have to correct this here. I do not need to open abdominal site. We passing through, we choose femoral area or groin, passing this one and correct it. So this is the one option you can choose. Measure the chest tube drainage, nothing. This question not related to the chest tube drainage. It is not an answer. Monitor the fluid intake and output. Yes, it is the another option to take care of the patient. And also palpate and monitor the peripheral pulses. So a patient undergo to the correction of abdominal aortic aneurysm as a RN, there are 5 options. Which one need to take care during the management of this patient? One is check the bleeding at the growing puncture site, monitor input output, and palpate and monitor the peripheral pulses. Why? If any kind of obstruction, blood does not flow, and we can find it out by absence of pulses. So if my kidney is working or not, I can find it out by input and output chart. Both is important, right? Now I'm going to just read and learn. So endovascular and abdominal aortic aneurysm. So during the repair of abdominal aortic aneurysm, the minimally invasive procedure that involve the placement of a sutureless aortic graft inside the aortic aneurysm via femoral artery. So in the picture number 1, my patient has a aortic aneurysm, and this is the bifurcation of the femoral artery. In the picture number 2, the surgeon passing through, right, to the channel, so we call it femoral approach. So it is the minimally invasive procedure that involve the placement of a sutureless aortic grafting. This is the graft. In the picture number 3, graft, and picture number 4 is completely okay after correction. So we can tell femoral artery approaching. It does not require an abdominal incision. The nurse will need to monitor the puncture site at the groin area for any kind of bleeding or hematoma formation. So if we see the bleeding, if we see the hematoma, we should notify to the healthcare provider. Peripheral pulse should be palpate and monitor frequently in post-operative period, right? Very important. So my kidney is working or not, or renal artery, any obstruction is occurred because of handling this correction of abdominal aortic aneurysm. We check the input output. If I see the input and output is not equal, I have to think. So renal artery occlusion can occur due to the graft migration or chance to develop thrombosis. So careful monitoring of urine output and kidney function should be the part of nursing care as well. Abdominal aortic aneurysm or cerebral aneurysm, both is very important for NCLEX board exam. Question: A nurse is caring for a client on the first day post-operative after having minimal invasive direct coronary artery bypass grafting. So a RN take care of a patient after the coronary artery bypass grafting in the first post-operative day. Very important for the patient, right? The client thought that this surgery was supposed to have a much easier, and asked the nurse why it is so painful. So what are the best response by the nurses? So when we go for the explanation what I'm going to do, it is very as usual. Patient can think maybe the procedure is very easy, but when you go through and educate them, take a deep breath or what for what, then or after the surgery, if patient feel little bit complicated, they can ask the question. It is their right, right? So my patient asking me, I thought The surgery was supposed to have much easier recovery, and asked the nurse why it is so painful to take a deep breath. So when I'm taking the deep breath, definitely abdominal or chest muscle will participate in expression or inspiration. I can feel the pain. If question asked by the client, what would be the best response, right? So I'm sorry, you have much pain. It does not make any sense. It does not make any professional answer. I'm sorry. Number two, let me call the healthcare. You do not need to call to the healthcare provider to answer this question by the patient, right? Why you are there? You have to manage your patient. Number one, number two, never ever the answer. Take a deep breath while splitting your chest with a pillow and use your incentive spirometer every 2 hours. So why this question does not related to the spirometer? So it is unnecessary. The overall recovery time is expected to be shorter. Because of our clinical skill, it grows and we anticipate about the case, how long take time to recover, right? But sometimes something is happened and every case is not same. But initial postoperative pain can actually be higher with the coronary artery bypass grafting because the incisions are made between the ribs. So this is very logical answer. So in this picture, we can say coronary artery bypass grafting incision. So the first picture, it is the midline, this is the sternum. So this is the traditional grafting, but we do right now the grafting in between to the ribs. So this is the one ribs, other ribs. In between is called intervertebral, intercostal muscle. We cut the intercostal muscle, and this muscle is very important for respiration. When patient continue the respiration, this muscle participate and patient feel pain. When you cut this muscle, we call thoracotomy, which is essential during the coronary artery bypass grafting. Life saving is most important than little bit pain. When patient question asks, definitely it is my responsibility, accountability to answer them, make them satisfied. So about the coronary grafting, it does not involve the sternectomy incision or placement of cardiopulmonary bypass. Several small incisions are made between the ribs. A thoracotomy scope or robot is used to dissect the internal mammary artery. So this one, this is the, if we cut the sternum, this is the bones, more painful to cut. It's called sternoctomy incision. But nowadays we go for thoracotomy. It is easier than this, less complicated. But still, patient have feel some pain, right? So radial artery or saphenous vein may be used if this artery, I mean the internal mammary artery is not available. Recovery time is typically shorter with this procedure, and the client are able to resume activities sooner than the traditional opening the chest coronary artery bypass grafting. However, the client may report higher level of pain with the coronary artery bypass grafting due to the thoracotomy incision, right? And this incision made in between two ribs. So what are the nursing intervention? Let me read it. The nurse should educate the client that the incision made from thoracotomy incision between the two ribs and may be very painful after the grafting surgery. The nurse should encouraging the client to take a pain medication before the pain is too intense. The client should also be instructed to cough, take a deep breath while splinting the chest with a pillow. Use the incentive spirometer routinely to reduce the incision of post-operative complication. A good question it is for NCLEX board. Now let me go the next question. Every question is one important information. It helps us to learn and pass the NCLEX board. A client with a chronic heart failure and called the clinic to report a weight gain for 3 pounds. So any patient have a heart fail or congestive heart failure, weight gain is not a good sign. Weight gain is bad sign because it indicates the fluid retention in the body. This is the reason we always tell we have to measure the body weight every day, right? We weight body weight for what? To see any kind of weight gain or loss. Why weight gaining? If fluid does not expel out from the body, if fluid retention inside the body, weight should be gained. It indicates something wrong inside my body, right? So this client make a phone call and told body weight gain 3 pounds over the last 2 days. Which information is the most important for the nurse to ask the client, right? You see, the most important, every question is important related to this patient, but which is the most? Question number 1, diet recall for the current week. Number 2, fluid intake for past 2 hours. Number 3, medication and doses taken over the 2 hours and placement of shortness of breath, coughing and edema. So my friend, you can read the 3 questions, right? Number 1, 2, 3, and 4. To answer or to find out the correct answer from here, you do not need to the master of medical science. It makes sense. My patient has a chronic heart failure or congestive heart failure, weight gain. There are 4 questions which is the most important, right? So question asks about the diet, it is not the priority. Fluid intake is important question. In input and output, we can measure it, but fluid intake the past 2 days, it is not that much important too. Medication dose, you can ask this question also, but not most priority? Because the most priority answer is there already. So always keep in mind A, B, C, D law. What I always encouraging my student, always better to follow A, B, C, D law. First is airway. Second is breathing pattern, respiratory pattern, and C, any kind of circulatory problem. So presence of shortness of breath, it means the respiratory problem. Shortness of breath means difficulty of respiration or breathing, coughing, and edema. Most appropriate for this patient to asking. So let me read their explanation. The client with the chronic heart failure at the risk for exacerbation that may require hospitalization. So this patient, chronic heart failure is a chronic medical condition. Because any chronic disease sometimes attacked, we call acute exacerbation of the chronic disease. Always we educate our patient, if you have a chronic disease, it is good to stop the acute exacerbation or attack and life-saving, right? So the priority for the nurse on the phone is ascertain if the client is experiencing any pathological symptoms such as shortness of breath, coughing, and edema formation. This is the first priority. This could indicate the fluid overload. The information can help the nurse direct the chest to come in for the assessment, follow the protocol to make the change in medication, doses, and any kind of restrict fluid. The client with a chronic heart failure is the risk of exacerbation. Client could be instructed to report if they gain weight, right? So gain weight is 3 pounds over 2 days or 3 to 5 pounds over 1 week indicated. Inform to the healthcare provider. The nurse priority to assessment should be any physiological sign and symptom of fluid overload. So shortness of breath or retention of fluid like edema both indicate the fluid overload. So next question, the RN is admitted a client with a heart failure related to the fluid overload. Which action should the nurse complete first? So during the NCLEX board exam, when you read the question, it is very important to find out the keyword. So in this question, say which action should be nurse complete first, right? So you should mark it. There are 4 options. Which one? Admin oxygen. It is very important. A patient who have a heart failure and fluid overload, maybe they have a shortness of breath, give them oxygen is the important. Assess the client chest sound, but before give the oxygen, you have to check assessment. If you see patient do not have any shortness of breath, oxygen saturation is okay, that times you do not need to put the oxygen. So assessment is first. And they said which action should be the complete first. Even number 1 and 2, assessment is most important. If you see your patient chest is clear or Saturation of oxygen is more than 95%, I do not need to give them oxygen. Initiate the cardiac monitoring. Yes, I can do it by EKG, right? EKG or ECG. So, but again, my friend, I want to tell you what are the most priorities. Insert the peripheral IV catheter. It is the least important, right? Out of this four. So always we have to give the priority. My first priority, check the respiratory system, airway. If any kind of obstruction in the lungs, you have to clear it. If any excess secretion in the throat gland, need to the suction, facilitate the respiration. So airway is the first priority. Then check the breathing pattern. Respiration is okay or not, any shortness of breath or not. Then go for C, means cardiac or any circulatory problem, any active bleeding, you have to stop. So cardiac monitoring is also not the first priority. First priority, assessment. Assessment for what? Respiratory assessment, airway assessment, breathing assessment. So we choose number 2. Next here, explanation. The client is being admitted for congestive heart failure who have a complaint of fluid overload. Fluid overload occur. It indicates maybe my patient has a respiratory complication. Is likely have a dyspnea, means difficulties of breathing, or orthopnea, means lobulated breathing in a supine position. So when patient is go supine position, they feel the shortness of breath. They immediately wake up and go to the window. They feel if I take the air, I can feel good. Paroxysmal nocturia means shortness of breath during the night time, right? Or also waking suddenly with the difficulty of breathing and look for the air. Everything is a sign of fluid overload. The assessment phase of the nurse process must for come before intervention. What next? I'm going to read the red line first. Assessment phase of the nursing process must come before interaction and should be prioritization or priority to using the ABC airway. A stand for airway, B stand for breathing, and C stand for circulation. Therefore, the nurse should first assessment the client breathing sound. Very important for our NCLEX board. What are the education tools or objectives? The client with heart failure related fluid overload usually has a respiratory symptom. Assessment of the client breathing is the first priorities. It should be performed before assessment or cardiac rhythm and interventions such as oxygen and placing the IV for diuretics administration. The nurse is caring for a client with chronic stable angina. So I'm going to read the next question for you. This is that here. the RN is caring for a client with a chronic stable angina, right? So angina. So when the blood supply is reduced to the heart because of the underlying cause, patient's symptom develop angina. So when they work, they're okay when in the resting phase, but they're not okay when they do something we call dyspnea during exertion. The client take the long-acting nitroglycerin or nitrate isosorbate mononitrate. It is vasodilator. So patient already go to doctor office and doctor give them nitroglycerin, which client outcome indicate that drug is effective. So these clinical cases we found the patient is very beginning state of angina and it's called stable angina. So if the patient have a stable angina, usually they complain, I'm okay all the day, but when I start to work or when I start to do something, I feel chest pain. At the beginning, we give them some nitroglycerin. Nitroglycerin is a vasodilator. They can increase the blood flow, right? And patient feel good and they can do their daily living activities without any complaint. So question come here. When you give this medication and patient, how you understand that nitroglycerin is sufficient for your patient? Out of 4, what is our answer? Patients say client is able to take shower or they can able to do that, get dress up and fix their hair without any chest pain. So daily living activities, right? So if my patient can do the daily living activities, it is indicate nitroglycerin can work. Number 2, client report reduction of the stress and anxiety. So it is not related to the anxiety or stress related. Nitrate isosorbate mononitrate does not have a role of stress or anxiety. It is not benzodiazepine like diazepine. Client report being abuse of sleep through the night. Hmm? Nothing related to this. Client blood pressure is 120/78 millimeter of mercury, heart rate 82. So it is normal. It is normal sign showing. So let me go and read the explanation first. So I said, if my patient do the daily living activity without any exertion, it indicates drugs is effective and working. So here, long-acting nitrate are used to reduce the incidence of anginal attack. Nitrate are effective if the client is able to activities without the incidence of chest pain. The client should be taught to report any increase the chest pain and how to manage the headache and common side effect about the drugs. So if the patient have any complication like this, they will inform to the healthcare provider. As I told you, nitroglycerin does not related to the stress or anxiety reduce or any sleepiness, right? It does not indicate anything. So the ability to perform activity without chest pain is a desirable client outcome of the long-acting nitrate use. This is the keynote. The nurse would want to assessment for the outcome of the client taking this medication. That's it. Nothing big deal.